pelvis or only look at the pelvic floor.
Right.
And definitely if that's the case, then a lot of the picture is missing. So it's just, we're adding that knowledge to be able to look at the body in its entirety and actually help with a lot of common issues that come up in women's health that we're going to be talking about tonight. So we're hoping with what we talk about and answering a lot of questions that we get all the time, this will just help clear up a lot of misinformation out there about the pelvic floor and core. Whether you don't have children, whether you're pregnant, whether you're postpartum, whether you're many years postpartum, doesn't matter. All of this will apply to you. So as Chana mentioned, please leave your comments and your questions during the live recording or the replay, and we'll be sure to get back to you. So why don't we jump in?
Let's do it.
Yeah, Chana, if you want to start things off, why don't we start with what is the pelvic floor?
Okay. I mean, it's funny because I was chatting with a couple people today, and they're like, "Are you going to bring out your pelvis today?" I'm like, "Of course, we're going to bring out our pelvis today." So here's our pelvises. So I think that the thing that most people forget, they're like, so you're just going to hold in your pee and that's all the pelvic physio is. But this is actually your pelvis. I always forget how to angle that properly. And if you think about it, this is actually the center right there. This is actually the very center of your body, right? It's right at the middle between your legs and your upper trunk. So when we talk about the pelvic floor, and we'll discuss exactly what that is, it's really important to remember that all of the trunk muscles, all the leg muscles, everything intersects here. So when we're treating the pelvic floor, we have to take all that stuff into account too, okay? So this is our beautiful pelvis. It's shaped like a butterfly. That's why we made our logo a butterfly for Vital. And the pelvis itself, the bones come together at the front here at this beautiful symphysis right here, pubis. And the bones meet at the back, all the way at the back over here. This is your sacrum. Your lumbar spine is here, and your coccyx, your tailbone, is all the way down here. And we're talking about the pelvic floor. We're actually talking about 3 layers of muscles that kind of hang out inside the pelvis right at the very bottom. And there's an outer layer, a middle layer, and a deep layer. And they're kind of like a sandwich that hangs out at the bottom of the pelvis here. And they go all the way from the front of the pelvis, all the way to the back, side to side. And they literally sit like a bowl there, holding up everything. And they do 5 really, really important jobs. Most people are very familiar with the job of continence. So they ensure that you only release your bladder and your bowels when you're sitting on the toilet and ready to. I think that's probably one of the most shocking things that we talk about with people, that we talk about kind of common but not normal symptoms, which I feel like that's going to be a theme tonight. But many people are shocked that any leakage of urine or stool whatsoever when you're not sitting on the toilet and you don't intend to lose that urine or stool is actually, it's not normal, right? But it's common. And Anita's going to talk about that.
Yes, and we should also mention gas, because I think a lot of clients are surprised that when we ask about leakage of urine, stool, or gas, and they're like, "Oh, I had no idea that was pelvic floor related," but it definitely is.
And on the flip side, constipation as well. So, we see people who have the most amazing diets, who are exercising, who are drinking enough water, it's not everybody, but if you don't know how to relax these muscles and learn how to release, that's a very common cause of constipation as well. It's just as important to know how to hold it in as it is to learn how to let it out. But that's just the very first job of the pelvic floor. There's also a sexual function. So if you're having pain with intercourse or lack of sensation or any sexual activity, it's a job of the pelvic floor to ensure that is functioning well. And if it's not, a pelvic health physio can actually help you with that. There's the old adage, like, just have a glass of wine and it'll all work itself out. Sometimes it doesn't, and that's one of our major roles as pelvic physios. These muscles have a supportive function. So we chatted a bit about how, like, they're a bowl and they hold everything up. And I'm holding a pelvis of a female anatomy right here. And there's actually 3 holes. There's a urethra, vagina, and anus. And on top of each one of those 3 holes actually sits your pelvic organs. I'm having a lot of trouble figuring this out here. I'm orienting myself. So on top of your urethra, where your pee comes out of, actually sits your bladder. On top of your vagina sits your uterus and your cervix. And that gets tucked in here very nicely. These are really fun, these pelvises, is all I have to say.
People they're good visuals. Clients find it super helpful though, and hopefully everyone watching this just to get a visual, because people get told to do Kegels all the time and no one knows what these muscles look like. This is good, Hannah. Keep going.
Okay. And on top of your anus actually sits your rectum, and your rectum gets tucked in right in there. But the thing that people don't really remember is that your rectum's connected to your intestines, which is connected to your stomach, your spleen, your gallbladder, your everything is literally held up by these 3 layers of pelvic floor muscles. And so one of the really important jobs is keeping everything up and where they're supposed to be. These organs are actually held up by ligaments as well, and they should be held from below by these muscles. So the holding them in place is something that we consider very strongly when we're treating people. The other 2 jobs of the pelvic floor are they actually help pump blood back up to our heart. So when a lot of us know when we're on flights that see a lot of people pumping their ankles to prevent blood clots, because we kind of understand that your calf muscles have a large sump pump activity, but the pelvic floor muscles also are actually a sump pump muscle. So they have to know how to actually contract and relax in order to properly pump blood back to your heart. One of my favorites. And last but not least, and I think we can all agree that this is our very favorite function, people are shocked to find out that the pelvic floor is actually part of your core. The term core has been, we'll say, misguided, misused. Your inner core system is actually your pelvic floor muscles, your diaphragm, your breathing muscle, your inner abdominal muscle, and your inner back muscle. And I've been asked to do the dance, so I'll just do the little dance quickly. Your diaphragm actually sits underneath your ribs, and it's kind of upside down U-shaped. And when you take a breath in, it should descend down into all those organs we just finished talking about. Your intestines, your gallbladder, your spleen, your stomach, all your intra-abdominal organs kind of get squished when you take a breath in, and they should create some pressure downwards and force the pelvic floor to actually relax when you inhale. And as you exhale, those guys should spring back up. And so those 2 muscles work together with your inner abs and your inner back muscles. So every inhale, your diaphragm contracts, pelvic floor will relax, your abdominals relax, and as you exhale, your diaphragm will actually relaxes, pelvic floor contracts, and these guys contract as well. So that's our little dance. Inhale, exhale. I can do that all.
And I love how, so Jen, hi Jen, she commented that such important information. I know I was surprised to know that pelvic floor muscles could be loose or tight, and makes perfect sense, but didn't occur to me before learning all this. And Jen, you're definitely not alone. I think this is so common. When Hannah or I or any pelvic physio starts educating clients on these pelvic floor muscles, we want them to act like a trampoline. We want give and we want strength. And if they're really tense, you're not going to get that give. And if they're really lax, you're not going to get that give either. So when we talk about this idea of tension, because they're just another set of muscles, they just happen to live on the inside. When people are like, oh, they could actually be tense. And I would say a lot of clients, both of us see, actually have tension in their pelvic floor.
Yeah, more commonly than I find people who need to, we eventually strengthen, but I think that most people come in overusing those muscles.
And something also about the pelvic floor I think a lot of people don't think about is, so diastasis, which we've done a Facebook Live on before. So just briefly what it is, it refers to when our outer abdominal muscles, so kind of our 6-pack muscles, start to sit wider apart. And that often happens with pregnancy, especially by the 3rd trimester. It's not uncommon for expecting moms to have it to a degree. There can be different areas along the center you may have that separation. And what's even more important than the distance is what we call the tension. So kind of how deep we can go into that tissue along the center. But basically the pelvic floor, as Chana talked about, that deep core canister, the pelvic floor is at the bottom of the core. So even when we're rehabbing a diastasis, we're taking into account the pelvic floor. It is an important part of that canister to actually help the diastasis heal as well. So I think sometimes when we think abdominal separation, we think, okay, it's everything above and it's just on the outside, but we just got to make sure that that you don't forget about the pelvic floor, because it's there supporting from the bottom. And issues with the pelvic floor that you may or may not be aware of could actually be contributing to why your diastasis may not be healing as quickly or as much as you would like it to.
Right. And like, how does alignment tie into that, would you say?
So as Chana talked about her little dance, so kind of your diaphragm and your pelvic floor. Ideally, initially, when we're starting with rehab, often a lot of physios, or Chana and I, and a lot of people trained similarly, will stack your diaphragm over your pelvic floor because they work together.
Easiest position.
Yeah. So Julie Weeb, physio in the US, talks about like this piston breath idea. So as Chana talked about, as you inhale, both lower, as you exhale, they lift. And so, Chana, are you able to demo? You're really good at demoing this, the ribs over pelvis.
You're gonna see my belly. Okay.
So, if you don't mind, you don't have to if you don't want to.
You ready? Okay, so here's our hands. So very often we see people tucking under.
Yeah.
And actually what we're looking for is more of a ribs stacked over pelvis. I don't know if I have to like move back a little bit. Ribs stacked over pelvis position. So we see people walking around like this, where they're kind of crunched forward, or and then lifted up through their upper ribs here. And what we actually want is you to stack by kind of lifting and making sure you're pointing everything is forward.
Yeah, basically bringing your ribs. So oftentimes it's bringing, a lot of people will kind of have you change your alignment from your pelvis, or I don't even like saying alignment, changing just how you stand, your posture from your pelvis.
Finding a breath that makes it easy.
Yeah, but actually shifting your ribs, so shifting kind of your diaphragm over top, actually can make an even bigger difference. And so a lot of clients will feel like they're tipping forward, because a lot of times we're used to, whether pregnant or postpartum, kind of the mom posture is tucking your bum under. And if you look sideways to a mirror, your ribs tend to sit behind your pelvis. So we're just bringing your ribs over.
It's like, it's the holding your baby like this posture, right? It's baby like sits here and we kind of like hang out.
Or when you're pregnant, right? When your belly grows, your chest grows, our body is like, okay, how am I going to compensate? Right. So let's start moving backwards, and baby comes out, and then we stay there. So making that shift and then checking where you're breathing. So even just take a random breath, how you naturally stand, and then see if you can bring your ribs forward over your pelvis. You might feel like you're in the Olympics doing kind of the ski jump. You might feel like you're way forward. But if you look in the mirror,
doesn't want to feel like they're in the Olympics? Come on.
But actually, when you look in the mirror, a lot of clients are surprised, because they'll have them stack ribs over pelvis before they see themselves in the mirror, and they feel like they're forward. And then I'll stand them sideways to the mirror, and they look and they're like, oh my gosh, I'm actually straight. I'm not tipped forward.
Or when you have them like tilt their pelvis, they're like, I feel like I'm, Cinderella stepsister sticking my bum out. And then they look in the mirror, they're like, it's like, like it's like a tiny little shift, and it feels so huge. But those tiny little shifts can sometimes make the biggest difference.
Totally. So those are a couple things you can already try at home. And for anyone just joining us, thank you and welcome. And tonight, what we're talking about is, what is pelvic floor physiotherapy? Because there are a lot of questions. So definitely leave questions, comments below, and we'll be sure to get back to them either right now during the live recording or on the replay.
Yeah. And I kind of jumped ahead. So why don't we talk about who needs physio? And what kind of conditions do pelvic physios treat? You want to take a stab at that one?
Sure, yeah. And just as a reminder too, is that Chana and I have done quite a few Facebook Lives already in the past weeks and months on a lot of these topics. And so tonight is just kind of bringing it all together, but definitely if you're wondering about a specific topic, go back into our Facebook Lives, and we're going to post some of the resources below, and then you can get a specific video on that topic. So some of the very common issues that we see. So as Chana talked about initially, losing urine at any time, unless you're sitting on the toilet. And so whether coughing, sneezing, laughing, exercising, picking up your little one, doing heavy weightlifting, skipping, doesn't matter.
Even if your bladder is full, right?
Yeah.
Like people are like, well, I did it, but I had a full bladder.
Yeah, it doesn't matter.
Still not okay. Yeah.
Yeah. Yeah, so losing urine, but then also, as we talked about, whether you're leaking stool or gas. So if you feel like you can't stop it, that's also the pelvic floor. Because as we talked about, where's my thoughts? There, off the top, right?
You're so much better at that than I am. Oh my gosh. I can practice.
So the pelvic floor, right? That whole diamond shape. So the back triangle, the back triangle, is our bowels.
I feel better now.
Exactly. It's hard to do this backwards. Is our bowels. So it's very, very important. And we talk about it all the time with clients. So it is something with your pelvic physio you can feel totally comfortable talking about. I know some clients will start talking about issues and they're like, this might be TMI. And I'm like, there's nothing TMI in my office. I've heard everything. As a pelvic physio, you hear everything, and we do not judge anything, and we just want to help you and help you understand your pelvic floor and core better.
Right, 100%.
Yeah, and so some other issues, and this is actually a really common one, is painful sex or any sort of internal penetration, whether it's pelvic exam, using a tampon, using a Diva cup. Doesn't matter. If there's pain, that can be often mainly related to your pelvic floor. And as we talked about, this would be not so much that the pelvic floor is really lax and loose. It's that there's too much tension going on in the pelvic floor. And there can be a lot of reasons this happens. So there can be, oftentimes there's a stress component. And when this happens, basically, it's often a protective mechanism. Right. So our brain wants to protect us. And
because we're really smart.
Yes. So it can be, painful intercourse can happen for many, many reasons. And for some people, it's from the very first time and it's always painful. So that tension has always been there. For some people, it wasn't initially, but let's say after childbirth or after a specific event, then the pelvic floor tends to tense up and then it becomes painful. So there can be a lot of different reasons for it. And we did a whole Facebook Live on it. So I highly recommend going back and watching it. Because it actually is extremely common, but it's probably one of the things that's least talked about. Yeah. I think incontinence is talked about more, diastasis is talked about more, but painful intercourse is not talked about enough yet. So
it's also one of those things postpartum C-section moms are absolutely shocked about because they're like, they didn't deliver a baby vaginally, so why am I having all this pain? And so I think we need to be open, we need to open that conversation up much more, right? And talk about how there's help.
Yeah, because it's very common. Yeah, after cesarean birth, pelvic floor can tense up after having a vaginal birth with tearing, episiotomy, or none of those. Right. No tearing, you can still have tension in your pelvic floor. So definitely a pelvic physio could help you address that and give you specific therapy, treatment, exercise to help get rid of that. Yeah. Another common issue, and this is actually, we're going to do a Facebook Live on this coming up specifically, is constipation. So in terms of our bowels, it is a big part. And a lot of people, again, we talked about, don't consider the bowels and the pelvic floor, like, how is that related? But now
system is like best friends. So it's part of the pelvic,
Yeah. Now that you're aware of the anatomy, right? And if you're just joining us now and you missed that part, keep watching till the end and then go back on the replay.
Go back to my awkward anatomy lesson.
Because it's important to know, because it does change how you'll view your body, your pelvic floor. You'll just have a whole new awareness. It can make symptoms so much better. Yeah. Another common issue we see is pelvic organ prolapse. So that's referring to either the bladder, uterus, or rectum starting to lower towards or in the vaginal canal. And there can be different levels to it.
We did a Facebook Live about this too.
Yes. Yep. So you can go back and watch that. Sometimes it's very obvious if you notice a bulging at the opening of the vaginal canal or beyond the opening. That could be in terms of a pelvic organ prolapse. And again, as pelvic physios, we see this often, and it is something to, again, see why this is happening. And often with pelvic organ prolapse, we will address, yes, the pelvic floor. If there's strength, we need to work on tension release, all of the above, but also what happens above. So as Chana talked about, in terms of, we have a pressure system as well. So if you think of that inner core canister, the top, the bottom, and around, and if you picture a balloon, and as women, we do this often, habits that we've learned this from a young age. Suck your stomach in, tuck your bum under, and lift your chest. And as pelvic physios, we actually tell you to do all of the opposite because our pelvic floor prefers that. So if you think of that,
alignment is key. Actually, Lisa said, untucking my pelvis was life-changing. Thanks to Chana.
I love that. I love that. It's true, because as soon as you, I think a lot of people are surprised that actually just changing the habits in themselves can already start changing your symptoms. Yeah. So if you picture,
and they're shocked by the amount, like the habits that they have, right? Like you can bring it to their attention and they're like, oh, I didn't even realize I'm doing all those things, right?
Exactly. Because that idea, if you think of your inner core kind of like a balloon, and you're just squeezing the center all day, the pressure in that balloon either goes up into your diaphragm, so then you can't get that nice diaphragmatic breath just throughout your day naturally. But the pressure also goes on your pelvic floor and pelvic organs. So even taking that habit out puts less pressure on your pelvic organs and could actually affect in a positive way if you have a prolapse. Right. So again, seeing a pelvic physio to find out what specific habits or treatment could actually help with your, in terms of supporting the organs and making changes there, is really key.
And I think that really speaks to like that external exam that we do. It's not only pelvis, but you know, when we're talking about clenching your abdomen all day, every day, and some of the pressure coming up, what that actually does is it starts to create this upper chest breathing.
Quite young.
Am I back?
Oh, there we go. Chana's back. Excellent.
Very dark. Okay, I see myself now. Whew, that was crazy. I was saying the stress response actually contributes to actually that clenching of the muscles, which we just chatted about, can contribute to all those symptoms, right?
And what are a couple other common issues that we see, Chana, in terms of pain-wise? Yeah.
One of the things that I think we talk about is that the, is this leaking? But I think it's something that I speak to a lot of clients, they're like, oh no, I don't have any leaking, but I can't make it through an exercise class without leaving to go to the washroom, or I have to pee right beforehand, I have to pee right afterwards. So I think things like, bladder frequency, or an inability for your bladder to you're not leaking, but you're worried you will, so you have to leave. Any urgency, any need to, that 0 to 100, really, it's a pelvic floor issue, right? But things that we don't commonly think of, and we have some really great studies now that are linking low back pain and hip pain is something we see so often. And in a lot of clients, it's almost the missing link for why they've had so much pain for so long. And so I think some of our recent research says 95% of people with low back pain have pelvic floor issues. Like, that is crazy, right? Like, these are people we could all really be helping. If someone would just say to them, hey, like, have you ever seen a pelvic physio before? And certainly our friends who see exclusively orthopedics, we're doing a great job of referring back and forth now. But really, like, diastasis, as you mentioned, is something that we see really, really commonly. And that's a whole body issue, right? It is totally pelvic physio, but it's also, like you talked about, that whole anatomy, the alignment, tightness in the leg musculature, weakness in some of the muscles, really getting all that aligned makes a huge difference. But if I were to say who should be seen by a pelvic physio, my across the board answer is anybody who has ever birthed a baby, because as we've chatted about many times before, you are forever postpartum. So your body is always a body that has had a baby. And so we refer very often back and forth with a lot of personal trainers who we love, who do amazing work. And who are really well trained in rehabbing diastasis and stuff like that. But I've seen clients who they say to me, like, no, they do not consent to an internal. They do not want to have an internal exam. And 6 months down the line, they're like, okay, fine, but like we're not seeing changes. And if you're making an assumption about what these muscles are doing without that internal exam, you kind of miss a piece, right? So I really say anybody who has ever had a baby should get that internal exam and know what your muscles are doing.
Exactly. And I think that's a key point, that we definitely work together with other fitness professionals, other health professionals, and so that we can work as a team to support the client to get the best outcome towards their goals.
100%.
And I think one other thing to bring up too, which is I think less commonly known than the postpartum reason to see pelvic floor physio, is actually to see someone during pregnancy.
Yes.
Because if you think preparing for birth, and whether you're going to have a vaginal birth, cesarean birth, whether it's planned as cesarean or you're not sure, you're thinking of a VBAC, there's always a good reason to actually check how's your pelvic floor and core doing, whether you've had children or this is your first pregnancy. Especially first-time moms really notice a difference going into birth and having an awareness of these muscles, how to engage, how to release, and especially for birth, knowing how to relax that area during labor. And then they also get a head start on postpartum recovery, because often nothing's talked about postpartum, especially those first 6 weeks. And then at 6 weeks, you get your green light to exercise again. And then you jump back into exercise, and you may have symptoms already, or you may not. And then you jump back into exercise and your pelvic floor and core wasn't ready. And then you start developing symptoms. Right. So if you back up and see someone during pregnancy, to then know what these muscles are doing, have that awareness, it can greatly help not only your pregnancy experience, so that you can get on top of any symptoms or get ahead of any symptoms, but also your birth experience and then your postpartum recovery. So that's something that I love talking about, because I think we definitely need to be increasing awareness postpartum, but I think we also need that pregnancy side too, and it can make a big, big difference.
Yeah, I mean, prehab is the new rehab. And that same vein, a lot of people are like, well, why, if I have prolapse or I have certain, conditions, I'm just going to have surgery. So why would I go to see pelvic physio? If somebody is going for shoulder surgery, of course they would go to rehabilitate those muscles. Again, these are muscles like any other. So if you want the best results from those surgeries, you should be learning how to use those muscles beforehand, and especially learning how to use them afterwards.
Yeah, in women's health, we still have a ways to go in that direction. In orthopedics, in terms of hip, knee, shoulder surgery, it's pretty rare for a surgeon to agree to do surgery on you if you don't do prehab, so physio before and physio after. If you don't agree to that, at least here in Canada, it's not often that they will do surgery.
Yeah, and if there's anybody watching from outside, we would love to hear if that's a thing. But we're moving, right? Like, we're evolving. So a lot of many surgeons will say, go do physio first and then come see me in 6 months. I love those people.
Yeah, definitely. In terms of, there's some wonderful, wonderful OBs who will send their clients beforehand to say, you know what, do physio first. Let's see how far we get. If we do end up doing surgery, then at least you'll have this new awareness of those muscles, and then you'll go back and see them after the surgery, whatever it is. just to, again, have that support from the bottom, because if you surgically, whether it's you're having like a bladder lift or anything to help with incontinence, if those muscles on the bottom, like we talked about from off the top, their job is to help support the organs and stop you from leaking urine, stool, and gas. So if you have surgery to change that, the physical side of that, but you don't have the support from the bottom, you won't necessarily get those lasting results that you're looking for. So yeah, something definitely to keep in mind. Even if you're like, no, I'm going to have surgery, this is definitely worth looking into before and after.
Yeah. Yeah. 100%. I think that the biggest question that we get is what actually happens during a pelvic physio appointment. Right.
So yes. So if anyone watching has been to a physio for anything else, so shoulder, knee, it starts off very similar, right? We're going to be chatting for a little bit about your history. So your health history, medical history, what are your goals for physiotherapy? As well as, any surgeries in the past, go through all the pelvic floor and core symptoms that may be going on. And if you've given birth, we'll be asking if you're comfortable sharing about your birth history, because that'll give us information. And then if you're pregnant, what are your preferences, or what are you looking for in this upcoming birth, or what are you fearful of with this birth? Whether you've already given birth or not, you may have some fears going into birth related to your pelvic floor. So these are all things that we definitely talk about initially. And then the physical side, we look at posture. So as Chana talked about, kind of ribs over pelvis, we'll teach you about that. We'll be checking your breath. Also looking at spinal mobility, joint mobility, muscle tension.
Looking at your back, right? Hip pain, looking at your hips. Same as you would with an orthopedic assessment.
All areas of the body, right? Because everything does attach in terms of the core, and everything affects that. So we're looking at that. We'll also check for diastasis. So how we talked about briefly, that abdominal separation, we'll be checking to see if that's there. For the internal part, so how Chana and I were very similar in how we do this, because we both have our pelvic models.
Oh God, where is mine? I found it.
I always use this with clients to explain what and show what the internal involves. We always want clients to know as well, we do not have to do an internal. We still can gain a lot of information from that initial history part and your symptoms, that we can actually start treatment without the internal. The internal just does give us more information, but if you're apprehensive about that, then don't let that stop you from seeing a pelvic physio.
It's our job to make you feel comfortable, and if you don't feel comfortable, we'll just do other stuff.
So kind of a general overview. So how I explain to clients is that initially, so similar to when you're going for a PAP, you're draped, we let you change kind of from the waist down, and then we'll come back in. But different than a PAP, because there's no stirrups, no speculum. It's in terms of, we're not poking and prodding or anything like that. We're initially actually pressing on the outside. So let me do it this way, along the pubic bone. So along the top, down either side. Down either side, along the perineum. So all this first layer of the pelvic floor, we want to see.
That gives us a lot of information.
Is there any tenderness along those areas or sensitivity? And then we'll have you do whatever you picture a Kegel to be. We'll have you do a big cough and a strain downwards, kind of like a bowel movement strain, so we can see from the outside what your pelvic floor does, how much it moves, what direction it moves. And then the next part, we also do a reflex in terms of at the pelvic floor. So similar to when you're a doctor and they do the knee reflex, there is a reflex for the pelvic floor. So it's a little flick at the rectal opening. I always tell clients, it's not painful. I'll let you know ahead of time. It just feels like, in terms of a little bit of movement there, but it is something we want to check to make sure there is that movement. For the internal part, we start the vaginal opening and just pressing around the bottom first, and then slowly going internal, always getting feedback from you. So this is not something where it's a no pain, no gain. We're never going to ask you to push through pain. If
somebody says to you, okay, just go ahead, then that's not somebody I'm doing an internal assessment on, right?
No. And we're constantly asking consent as well. So, and we make sure that you know that it's totally fine if we just start on the outside and then you're like, yeah, I'm good in terms of that's where I want to start, and that's totally fine. especially if you're coming in with internal pelvic pain, that's often where we start. And we can already start using breath work, visualization. Yeah, already teaching you how to release those muscles. And also with pelvic pain, there'll be a lot of nervous system work we do. So stress strategies, reducing stress, how to calm the body, mindfulness, meditation, a lot of different things. And then if we do go internal, then we're pressing along the different bands of muscles on either side, checking if there's tension or tightness. And if there is, that's a sign of tension in the muscle. So again, we'll start working on release work first. If there's no tension, then we'll check your strength, your coordination. So we'll have you cough and bear down. So we'll check your muscle strength, muscle coordination, as well as position of the organs. So we'll be able to see if there's a degree of prolapse in any of those organs.
I think people are actually surprised that we use the same grading, muscle grading system that we use for like your bicep, for example, we use for your pelvic floor. And we use that to evaluate where we're going next. The same way that if somebody had a shoulder pain, we would check out their shoulder muscles. We would do the same thing for the pelvic floor.
Exactly. And then the other part, because I always want people to know as well, if you're coming in with tailbone pain, or again, any kind of the bowel or rectal issues, we can either in the initial assessment or in a follow-up assessment, and again, depending on your comfort, is actually to get to the tailbone or to check the bowels, is actually rectally doing the internal, exactly the same thing, to be able to release around the area or check the muscles. So
and I mean,
that's
the
also
muscles go front to back. All people are, we think only the front part of the pelvic floor, but those are it's the same muscles. And I think that really important to do that as well. So it's a missed element. And it's something as well, like if somebody comes in and they're leaking during running, or they leak during deep squats, or they're having pain during running, or pain, whatever. If you're coming in with symptoms during a certain movement, we're always going to watch you do that movement as well. People have pain going upstairs, we'll watch you go upstairs. Like there's, we'll always relate it back and try to reduce whatever symptom you're experiencing during that time.
During that movement. Or movements related to it. And then after we do the internal, then we let you change, we come back in, and then we bring it all together. So the external assessment, internal assessment, all the information, explain it to you, how it's related to your goals. And then there may be some treatment done in that initial assessment, but explaining what treatment would be involved with follow-up sessions, how that all works would then be discussed at that point. So, and a lot of people think, well, if I go to pelvic physio, they're just going to tell me to do Kegels. And
usually not.
Yeah, well, some people will get strengthening again in a different component. So not Kegels.
It's part of my house. I'm about to lose battery, so give me 1 second. You keep going.
So while you may go home with strengthening in terms of that inner core, it'll be different than isolated Kegel muscles. So knowing how to use your breath with your pelvic floor and your entire inner unit may be where you start. But then there's always progressing specifically towards your goals. So if you're leaking while you're running, then learning how to engage your core lying down won't, fully resolve leaking while you're running. So you'll need to first learn how to engage and different postural strategies, and then we will be progressing that towards running. So whether it's going into lunging and working on your glute strength, all of that, and hip mobility, and just there's so many components to running that just learning how to engage your pelvic floor won't necessarily translate to stopping you from leaking while you run. So there's a lot of progression towards your goals, but any physio you see, that should be their main goal, is anything in your treatment should be building you back towards your goals.
100%.
So
I heard all of it. I just was plugging in.
So why don't we go into, Hannah, if you want to go into some of the causes of pelvic floor issues.
So what's interesting, sorry, grabbing all my stuff here. Losing it, but I'm getting it together. One of the things that I guess people are shocked about is that we do talk about this a lot during pregnancy, postpartum, and the postpartum period, that there are inherent changes in these muscles and in these core muscles during pregnancy. That the diaphragm gets shifted up, your pelvic floor has to carry so much more weight. your abs are going to get a little bit more stretched, your back muscles are going to get affected. We kind of really get that. But what I think that a lot of people miss is that once you have had a baby, you're forever postpartum. So even if your symptoms are occurring, much later on in life, your body is always a body that has had a baby. So, the different ways that you deliver can affect these four core muscles differently, but they all affect it. It's usually the pregnancy itself, though, that has actually that has affected the pelvic floor and this whole core system. But there, even having, we think about C-sections, even having any abdominal surgery will actually cut through a lot of the fascia, the abdominal muscles that can affect your whole diaphragm and the way that you breathe. We talked a lot about like holding in your tummy, right? So posture, persistent belly holding, but also breath holding. Breath holding is a surprisingly common way for people to actually compensate for things that they're not strong enough to do throughout the day. Or it's a really common habit that people have to just, and they don't even realize it. But what that does is it causes a consistent downward pressure on the pelvic floor, and it inhibits these four muscles from working together to actually maintain pressure and stabilize and support you. Persistent constipation, right? That's that bearing down, that constant bearing down on the toilet can actually cause pelvic floor issues, as can a persistent cough. So asthmatics are actually, sorry guys, pretty surprised to know that if they do have a long history of coughing or issues with their breath, that can actually really affect your pelvic floor as well. High impact sports, if your body is not trained properly for it. So I would say, I don't want to say high impact sports as a across the board, but I will say poor strategies with high impact sports can affect your pelvic floor. Is that fair?
Mm-hmm.
Yes. Okay.
Yeah.
And poor form during exercise in general. I think, shout out to our personal trainers who are our well-trained favorite people in the world. Like people have to learn how to perform exercise properly in the gym. It's almost sometimes, you look around and you see people using terrible form. You're just, that they're going to injure themselves down the road. So learning how to do exercises properly before you go out to do them, even things as simple as learning how to do bicep curls, how to do squats, how to do lunges. They're exercises that people do all the time, but if they're not done properly, that can have a negative effect on your whole core system.
And I think it's important to bring up, because we both do love a lot of fitness professionals and collaborate all the time. And there are so many amazing courses out now for both health professionals, but also fitness professionals who really have updated information about the pelvic floor and core, women's health, but also Physiotherapy. And I wanted to send a shout out to Laura. I'm so glad you're joining us. Yep, Hannah, you're back. And Catherine, who says, I love pelvic physio. That's amazing. So I'm guessing it sounds like,
hi, Laura.
Yeah, that you've gained some benefits from seeing a pelvic physio. So that's awesome, Catherine. So the podcast, and then as well, we've talked about how we've done a number of Facebook Lives. So you can either go back to the Holistic Health Physio Facebook page, Vital Physiotherapy and Wellness Facebook page, also the Holistic Health Physio blog. But we're going to be adding some of them linked below. So particularly when we did a Facebook Live on just pelvic floor issues in general. So we dive a little bit more deeper into that, how to engage, how to release your pelvic floor. So those are two of my top resources. So what are your two top resources, Hannah?
So one of the things that we keep talking about is how to find a pelvic physio. In Canada, Pelvic Health Solutions is an awesome website where you can actually they have a find a physio area, and you can search by location. In the States, there's the section on women's health from the American Physiotherapy Association. Those are really great options as well to search by location. We talked about we're gonna link a couple of our Facebook Lives as well. Because I think one of the things we feel very strongly about is preparing your pelvic floor for birth. All the prehab before birth, as well as the one where we answered all the pelvic floor questions. There is a quick question from Sarah. Hi, Sarah. And Sarah says, symptoms other than symptoms directly in the pelvic area, what other areas of the body do you see react in a negative way to a misaligned or untrained pelvic floor? Personally, I came with lower back pain that was linked to my pelvic misalignment, but what else could be a symptom that may be overlooked? And so, Sarah, way back earlier on in this broadcast, we talked about hip pain, persistent hip pain. We did talk a little bit about back pain. Some of the heaviness in the pelvic floor would be, tailbone pain would be very common. During pregnancy, some groin pain would be very common. Pubic symphysis pain, anything in that pelvis.
In the front.
Yeah, for sure. And sometimes rib pain as well, right? If you're not able to get that nice expansion, sometimes you're starting to see some upper back and rib pain that we can coordinate with this whole core piston and these all four of these inner core muscles. So I hope that answers that, Sarah. Let us know if we missed it. But
I would say
can add on.
Another common issue is when people come in thinking they have sciatica. Sometimes that actually can be referred from the pelvic floor, so tension in certain muscles. So any pain going down the leg sometimes can actually be from, or part of the factor is actually from the pelvic floor. There can be a lot of different other areas in the body that you may not suspect the pelvic floor is a part of it, that actually can be.
Right. And sometimes radiating up if your abs are overworking because they're trying to compensate, for what the pelvic floor muscles can or cannot do. We sometimes see really, really tight abs. You're welcome, Sarah. Okay, thanks.
Awesome.
Okay, awesome.
Yeah, so definitely if you're just catching us now and you have questions, feel free to leave them in the comments below. Hannah and I will get to them after the broadcast. And if anyone wants to find Hannah, how would people contact you in person or online?
So you can always find us at our website at vitalphysiotherapy.com. We're on Facebook at Vital Physiotherapy and Wellness, and on Instagram on Vital Physiotherapy and Wellness as well. You can contact me personally, I'm always happy to answer questions. And our clinic is located in Midtown Toronto. And Anita, how can people find you?
So my clinical practice is holistic health physiotherapy in Peterborough, Ontario, so just north of Toronto. And you can find me online at holistichealthphysio.com, as well as on Facebook and Instagram at Holistic Health Physio. And you can also find me quite a bit in terms of in our podcast Facebook group or Instagram. So the To Birth and Beyond podcast as well.
Yeah. And one thing I did just learn is that if, we say like our Facebook pages so that you can actually find these videos. But what I didn't realize is actually you have to like follow now. There's a whole process. You have to follow and choose how to follow. You have to choose to have the information come up first, right? Then coming up first. Because I've been told a couple people missed our past broadcast because just by way of the way that Facebook makes it happen. So if you do follow us, make sure that you're following properly, that you're getting the notifications. And please be sure to like our Facebook pages, and interact with us, be in touch, ask questions. And our next Facebook Live.
We're excited. It's going to be about, how we talked about constipation and bowel issues, how the pelvic floor is related to that. Tips you can already start using to help with that. With anyone watching currently, if you've heard of the squatty potty, we'll be bringing that up. And if you don't know what that is, Google it. There's some entertaining commercials.
Love it. We're going to talk about poo, basically. It's what we're going to talk about, people.
Yeah, and just how it's related to the pelvic floor. Yeah,
so important. Amazing.
Stay tuned for that. And whether you're again, if you're thinking of becoming pregnant, you are pregnant, you're a new mom, you're a seasoned mom, you've never had children, you don't plan to have children, doesn't matter. This topic and many of the topics we talked about do affect women of all stages of life. So make sure you tune in with us and also share this information so you can share these videos with friends and family. Because I don't think the day will come where Chana and I ever have a day where we don't have someone coming in saying, why did no one tell me?
Yeah.
So if we can share this information more, that's going to be one more person who won't be saying, no one told me about this.
Normal.
You can actually change someone's life and just how they interact day to day and just their quality of life by sharing this information. So thanks so much for joining us. And if you missed our chat today, the replay will be available shortly, and where we answer questions all about pelvic floor physiotherapy. So it's good to see you, Chana.
You too. It's my excuse to hang out with you.
Yes, exactly. All right. See everyone next time.
Okay. Thank you.